Okay, today we are going to do a Tit Talk Thursday. My name is Dr. Lauren Hughes. I'm a board certified pediatrician. I'm going to talk to you today about what you're going to do if you get mastitis or a clogged duct, okay? And it is not heat. It's not heat. If you get mastitis or a clogged duct, first I'm going to explain, how do you know? How do you know? How do you know? So a clogged duct is going to feel like a knot sometimes, like a ball, or like you just got punched in the boob. It does not feel good. And so it's just this general inflammation of the milk duct. Now, mastitis is when you get an infection. And here's the thing, you do not get a bacterial infection like immediately. That is not a thing. You don't need antibiotics at the first sign of redness. Why, Dr. Hughes, doesn't redness mean infection? Sometimes, but sometimes not. So redness can just mean that blood is in the area. Just because there is redness does not mean that you have an infection if it's only been like a couple hours, okay? Bacteria doesn't grow that fast. At the first sign of that punch titty feeling, you are going to do ice. You are going to do ibuprofen, and you are going to gently, nice to our titties massage, okay? You're not gonna Theragun, do that. You're not doing that. If after 24 hours or so, you feel like a fever, you got hit by a truck, all that stuff, that may be when antibiotics are indicated, but I want to avoid them. We want to avoid antibiotics if at all possible, okay? So that's why we do ice and ibuprofen, not heat. You are also not going to pump till empty. You are not going to nurse excessively on that side. You're going to nurse and pump like normal because we do not want to over-inflame and over-activate that area, which is what over-pumping and heat is going to do. Heat causes what's called vasodilation. Opening of those blood vessels. That's going to draw more blood. They're going to create more inflammation. Ice is a vasoconstrictor, meaning it makes it tinier and smaller. So that is what we want to do whenever we have inflammation, okay? Ice, baby. Summary. If you feel like you got pinched in the boob and it just started, ice, ibuprofen, gentle massage, nurse and pump like normal. If after 24 hours, you're getting it, that didn't work and we couldn't avoid antibiotics and you feel like you got hit by a truck and you got a fever, that is when antibiotics may be indicated. But as always, we try to avoid antibiotics if at all possible. And overall, be nice to your titties.